Hi, I'm Sarah Steeris. I'm a nurse practitioner at Austin Labiaplasty and Vaginal Rejuvenation. This is Dr. George Shashoua, and today we're talking about techniques for labiaplasty. So a lot of patients are wondering the difference between the wedge and trim technique and how you decide which one they need.
A little background on the wedge and trim technique. The wedge technique is mostly performed by plastic surgeons, and they wedge out the skin, undermine the tissue, and then close the area. And the
trim technique?
The trim technique is done mostly by gynecologists, and it's just where you go on a vertical line and trim the area. And there's advantages and disadvantages to both. If you look at the pictures of plastic surgeons doing the wedge technique, it's mostly a central removal of the labia. And when you look at pictures from gynecologists who do the linear or
the trim,
who do the trim technique, you'll see that sometimes there's just a lot of bulky tissue right where the clitoral hood and the labia meet. So what we do is we go ahead and trim the area along the clitoral prepuce and along the labia, and then when the two areas meet, we wedge that tissue out. And then we undermine the tissue, and then we take out any fatty tissue underneath to remove some of the bulk, and then we close the area so that what you're left with is a vertical line going from the prepuce down to the perineum, which gives you the most natural look.
So you do kind of a combination of the wedge and trim technique typically.
That's right.
And do you always trim the clitoral prepuce or the clitoral hood?
Just about always, because in most patients, if you think of the clitoral prepuce as an extension of the labia minora going upward, to get the area to look natural, both areas usually need to be addressed.